Good morning, Amrita. Thank you for joining us. I am Anupama Rao. I am the lead for the volunteer program uh, for Praanwellness. We are based out of Hyderabad. We try to bring in interesting speakers to enable us and educate us with what is the most needed to our community. And once again, thank you. And I am seeing you're an advisor for the transgender well-being and advocacy. Amrita works for Alliance India. It's a non-governmental organization in partnership with the civil society doing community-based work with the HIV program. So that's what I could shortly, briefly introduce you to that. So, that is my short introduction. But yes, we have a lot of questions. We are so interested to know the kind of work you do. Yes, over to you, Amrita. Thank you again for joining us. Please introduce yourself.
Okay, so thank you so much, Rupamaji and Pranfa Foundation. All of you are doing very good
Yeah.
job, and I'm very much thankful that you are organizing this session. And this is in the Pride Month. This is
Yeah.
absolutely
Oh, thank you. Thank you
important.
so much.
Yeah.
Yeah.
So
Pleasure
I
to have you with us.
Yes, thank you. So I am basically currently working for Alliance India or India HIV/AIDS Alliance. So it's more than 20 years of experience for working of my LGBTIQ community and mainly for the transgender community, which I belong to at nationally and globally for the overall development, skill building, comprehensive healthcare, and all this. So maybe I can start with a brief introduction with our organization, the kind of uh, uh, activity we do actually. So I'm
Sure.
just trying to do the screen sharing.
Sure.
Yeah, yeah. I hope this is
Yeah, the screen is visible. Yes.
visible. Yes. Okay. Oh, suddenly the power goes off. I hope it will become soon. Like no issue. Yeah. Yes. Yes. So actually, also I would like to talk about the basic objectives of today's session that our conversation will mostly include, and that the introduction part. And sometimes we do not have clear understanding or clarity around the various terminologies that we use according to our gender, sex, and sexuality. So that part also I would like to touch upon.
Okay.
And definitely we'll talk about the challenges, and this is very much important. What kind of
Yes.
challenges the LGBTIQ communities are facing based on their preferred gender role or alternative sexuality, and then how we can provide or promote more acceptance for this marginalized community, and what we can do to make our situation better.
Definitely. Definitely.
Yes, so I'll start with this great quote. That is actually the Article 1 of the Universal Declaration of Human Rights is saying all human beings are born free and equal in dignity and rights. So I think in today's world where we are talking about equality, comprehensive services and all, I think this is a basic thing, very basic thing. We have to remind that everyone is equal and we should not judge any one of them based on their like any other like characteristic. It can be gender, it can be sexuality, it can be caste,
Right.
religion, anything. I think a human should be based should be judged based on his or her talents only, not any other things. Yeah.
I couldn't follow the last sentence you said, ma'am.
Yeah, I told that all the human beings will be judged based on their talents, not based on any other uh, parameters like gender, sexuality, and all the stuff. Yeah. So, yeah. So, talking about Alliance India, we
Yes.
have started in 1999, and for the long time we have been helping the community who are mostly affected by HIV/AIDS. That includes living with HIV, men having sex with men, transgender, hijras, people, women who are engaged in sex work, and people who use drugs.
Okay.
Basically, also if I talk about our offices, yes, we have our head office in Delhi, and apart from that, we have two other states office and one regional office in Guwahati.
Okay.
So we work very closely in partnership with various government departments, such as health department, any other state, governments, the civil society organization, CBOs, community, private stakeholders, corporate entities, and research and educational institute. And we collaborate actually in all the 32 states and including the Union Territory, including NACO, SACS, state networks, CBOs, and all the NGOs.
Okay.
And according to 2020 data, we have reached around like 1.6 million registered clients with our various services. And in terms of the number of the partners, we have like more than 400 CBOs and NGOs who are
Okay. So
working
if
with
I can
us.
ask you, Miss Amrita, you said
Huh.
that you're based out of Delhi.
Yeah.
You have, you have another center in Guwahati.
Mhm.
Is that right? You
Yeah.
said?
Yeah. Yeah.
Yeah. So I know this is pan India.
Mhm.
So if I might ask you, how are you in? How do you reach out to the other states and the other regions?
Yeah. So basically, there brings our program that I will talk, I think, in my next slide also.
Okay.
We have a program that is supported by Global Fund. It's called Vihan. We have more than 300 community care centers actually spread across throughout the country. And there actually we work very closely with like several uh, key populations including MSM, including transgender, including female sex workers. So we have dedicated community care centers, community support centers in all the states. Yeah.
Okay. Um, your voice is a little bit not clear, but
Okay.
yeah,
Okay. Is it audible now? Yeah.
yeah, yeah.
Okay. Great. So next, actually, I would like to talk about what kind of like services and overall idea that the kind of activity we do. So we work in the partnership with Government of India, as I told,
Okay,
that's civil society organizations, people who are affected by HIV, and through
okay,
our range of services.
okay,
And the focus are basically the services is on like HIV prevention, care and support work. We also try to address gender-based violence, sexual and reproductive health, including implementation of what I was, taking just now.
sexual and reproductive health. You said.
Yes,
Okay,
this,
okay,
that I was just telling that we have more than 300 community support center for the key populations, and including there are 10 transgender CSCs.
okay,
And our most important stakeholders are like transgender and hijra people, people who use drugs, people who are living with HIV, men having sex with men, youth, and female sex workers. And
okay.
apart from healthcare services, we also conduct sessions from time to time from educational institute, and that is
You said
basically to,
educational institutes.
yes,
Okay,
educational institutes and workplace to promote, comprehensive like care, acceptance in all these places, so that no one can be judged or no one can be discriminated. Like
care. I think care is the most important word, right? Yes,
yes,
there's that's the most important thing. Yeah.
yeah,
Go on.
yes, because I think also you have seen based on one's sexuality or gender identity, there's a huge rate of dropout from the school, college, and all.
Yeah.
So that should not happen.
Yeah,
Uh,
there's a lot of bullying, there's a lot of name calling. I think they are so vulnerable.
yeah,
I think they get they their mental state of mind is affected so much, and
yeah,
the care has to start from the beginning, from
absolutely.
puberty onwards, when they start to identify themselves. So
Yeah,
I think that's yeah, the care is the most important. I agree with you, Miss Amrita.
absolutely. And I we work for like important government organizations like state AIDS control societies, national AIDS control organization, central and state. We education, social welfare department, and other uh,
Mhm.
government stakeholders. We also partner with UN organization and various other international forums.
Oh, I see. Okay. Okay.
Yeah, and how we do that, like for example, at NACO, we are associated with technical resource group. Uh, I mean, I'm a transgender person. It's a transgender technical resource group which I'm part of. There we try to, advocate for comprehensive healthcare. I mean, most of the time, for example, if you think about HIV/AIDS program, they are only, limited into distribution of condom, HIV testing and all. But apart from that, if I talk about the transgender community, absolutely it is important to talk about holistic healthcare. I mean,
Correct. Correct.
uh, I
I
mean,
think that's the most important thing. Yeah.
yes. I mean, as you know, if I talk about gender affirmation care, that is absolutely missing in most of the healthcare
Hmm.
sectors. So how we can make our HIV services, how we can link it with other existing healthcare services, that is absolutely important. And there are other areas like access to PEP, and also we have helped
You said access to, ma'am?
PEP. PEP is actually pre-exposure profile access. So that is not very familiar in our country. I mean, most of the time we think that HIV it's prevention and uh, is limited, the- just to helping the community, helping the key populations by spreading awareness, or linking them to services, or linking into testing. But sometimes it happens that without information, uh, people can be infected by HIV, and there are still some medical, intervention that we know as PEP or PEP. But those are mostly available in other countries, but not in uh, uh, India. So this um, drugs, or this medicine is called pre-exposure prophylaxis, is very important. For example, if someone is going for an unprotected sexual practice, and he or she has an idea that, okay, I might be affected, or there's a chance to get infected by HIV, then definitely this precaution drugs is called pre-exposure prophylaxis, or PrEP, can help us out. Yeah. And
Uh, just that, you're not too audible, Amrita. I
okay,
just want to just let you know.
okay.
Um, be-
uh so if remove this, am I audible now?
yes, yes, please.
Okay,
Yes.
then I'm trying to speak without the
Yeah.
phone. Okay.
Yeah.
Thank
Yeah.
you.
Yeah.
So we also helped National AIDS Control Organization to develop, a transgender health white paper that
Okay.
we're talking about, that how more comprehensive HIV/AIDS care can be provided in involving all other existing healthcare support, and then and you will be very happy to know that AIMS, All India Institute of Medical Science,
Uh-huh.
of National AIDS Control Organization, they are going to set up already. They are through to it, a center of excellence for transgender health. That is very
Okay.
very much important, because in our country, if I talk about gender affirming care, we don't have any specific guideline. A
Mhm.
medical guideline is absolutely important.
True, very true. Yeah, medical guideline has to be given, and I think, yeah, that is where we need to concentrate. Yes, I agree with you on that. Yeah.
Yes, so
So
Center of Excellence will take a lead role how to train the healthcare practitioners in terms of transgender healthcare, and
true.
what are the medical guidelines that has to be taken care of. So they will play the role. And
Okay.
our employees have been part of, I mean, various forums. I mean, I had my ex-colleague who is at the UNS program coordinating board. I was also involved with Global Fund CRG group, that is Community Rights and Gender group, then and other NGO delegation board to Global Fund. And according to the HIV program, we have been actively engaged in helping National AIDS Control Organization, uh, development of National AIDS Control Program phase 3, 4. Now the NACP program phase 5 is also there. And we have also contributed to the National Strategic Plan for HIV/AIDS and STI, that is for 2017 and 2024. So these are the main activities in a nutshell.
Okay.
The kind of work we do, and you can see it is not limited into just distributing condom or helping the community to get tested and linked to ART, because we believe our 360-degree approach is absolutely needed, where you have to involve the community, you have to involve the other stakeholders, you have to involve the healthcare service provider, the government departments. Then only a comprehensive approach, a comprehensive healthcare can be done.
Okay. So now, if we can just, I can just ask you a few questions
Yeah.
about, about LGBTQ community, if we have to say. Maybe, without the slides, you can just right away tell me, so that the audience, we are able to understand what you're saying better. Yeah.
Okay. So actually, yes, slide is there, but I'm not going to merely read it out. See,
Yeah.
the problem comes when we hear about sexuality, gender, but
Yeah.
we don't have a clear understanding. There,
Correct.
there are definitions and there are differences. I mean,
Correct.
sex is basically biological features, and
Correct.
sexual orientation, it absolutely more broader, how we are attracted to other people. And
Mhm.
gender identity, if I talked about, it's basically the gender norms. Most of the time the society want us to follow that. Okay, you are assigned male or birth, you have to, if I give example, that you have to play football, you have to play with other boys and guys. And if you are female assigned at birth, most of the time you have to do the household work, you have to
Yeah, that's a oriented sports and a female oriented sports. Like,
yeah.
you cannot play a kabaddi, but you can play coco.
Mhm.
These things are always ingrained in our mind,
Yes,
by our community. Yes, I agree with you.
yes.
Yeah.
And gender expression is how we want to express ourselves through
Correct.
different behavior, through different identity. And when we talk about sexual health, most of the time we think that it's basically any kind of a sexual health related disease and all, but it's not. It's also
Yes.
include our emotional well-being. It also include our physical health, mental health, everything.
Yes, of course, of course. I agree. I agree to what you're telling me. Yes,
and
emotional support is the most important thing. Yeah, in
and
identifying yourself.
and whenever we talk about sexuality, we think about that it's all about having sex. Absolutely not. That is absolutely wrong. Sexuality is a much broader term,
Right.
where our own choice, our own understanding to ourselves, understanding to the whole world, how we want to see the different aspect. Like it can be like biological, it can be physiological, social impact, the
Yeah.
political engagement, the cultural influence. Everything is very very much important. I mean, I
Correct.
uh, give you examples. See, in India, we have so many states with so many different language and all.
Hmm.
Every state has its own socio-cultural identities, behaviors, and all,
Hmm.
and and that also include dress codes, behavior, language, everything. So
True.
also reflect, I mean, on my sexuality. I mean, for example, as a man or as a trans person or as a woman, how I am coming out with my identity, interacting with other people, what is my socio-cultural identity. It has a strong, I mean, a very large impact. So all these terms that that we mostly think that related to sex only, it's absolutely not true.
It's about our likings, it's about our choice, it's about our preferred gender role, it's about our choice of sexuality. And I think those areas are absolutely important, just like the cisgender people. I mean, everyone has his or her own choice. I mean, how I want to see myself as a man, as a woman, or as a cisgender person, it's absolutely should up to me how I want to see myself, how I want to live my life. And that is uh, absolutely important for any person in the society, and that we have to keep it in our mind. Yeah.
Right. I totally agree with you. It is a personal choice, and that is a person wants to express themselves, and they have to have the right for expression. Okay.
Yes.
My next question, if I have to ask you, when you're in these grounds, you must be facing a lot of challenges.
Yeah.
LGBTQ community as such will be having a lot of challenges concerning to education,
Mhm.
healthcare, legal, and livelihood. We see in our community, we see that this is something that is lacking.
Mhm.
There is a lack of empathy to the the community that we are to the community that we are talking to you right now. So if you can tell me what are the kind of steps that have been taken, opposed to what was in the past, like 20 years ago, what was and what is today. There's a lot more awareness. There's a lot more sensitivity when
Mhm.
somebody is addressing to somebody, or even talking about this casually,
Mhm.
even among youngsters. You can see that they're so sensitive towards it. The gone is the time when they used to say this was a taboo word. Today it is a very inclusive conversation among youngsters. So can you just tell me concerning to education, because I'm very concerned about, or rather, we from Praanwellness would like to know, when it comes to education and healthcare. I'm not going to go into insurance and all that, which doesn't much come into our Indian culture. We do not have, we are not still there. I do know in the West we have, they have insurance also and all that. But just tell me, just concerning to these four things. But firstly, education. Where would you say that we are standing right now? What are the challenges that we're having towards education?
Right, right. See, actually, even before going to that, I would say that education is the backbone of any civilized
True,
society.
true, true,
And
true.
I think I'm talking to you now. I mean, that has been also possible because of my education. I mean, if I'm not literate enough, how I can express the challenges, the pain I'm facing, right? Even that
Right.
means the communication power also, if I want to have, that's also, have some kind of a education. And the problem is that it's not only with education but other healthcare or livelihood, everything like
Yeah.
we
No, but Ms. Amrita, if I have to understand, like today in the stand of education,
yes,
I'm sure that there is a lot of challenges even now.
yes,
Um, so, how is the awareness that you're bringing to the educational
yes,
institution? What
yes,
are the kind of training that you're giving when you go into the education institutions?
yes,
Like you're telling that you're going to different centers, going to different
uh,
regions,
uh,
states. How are you reaching out? Is there any kind of an education that is being given to the teachers, to the community? Are you reaching out to the different schools? Is there any kind of a program that Alliance India is doing? I would like to know on that.
yes, yes, absolutely. I'll come to that, but even before that, we have to understand the problems. When I have identified the problems, half of the problem is sorted.
Correct. Absolutely. It's always like that, right? If you
Yes.
identify the problem is half solved. Yes.
Yes. And the thing is that, I mean, in our system, it's absolutely for any service areas, we don't have proper information, the data. It says that
Okay.
data speaks. For example, at a nationally, or if I talk about even state level, it is
Mhm.
very difficult to find it out. For example, how many people who have been drop out from the education, who have been drop out from the healthcare support and all. Most
Correct.
of the time, it is not reported, and that is happening because of lack of information, because lack
Correct.
awareness, and
Awareness.
sometimes
Yes.
it is because of internalized phobia I have in my mind.
That's true. That's true. Like families just want to close down. They
Yeah,
do not want to expose. They don't want the person to go out of the house. They want to take them away and keep them in solitude somewhere. They
yes,
want to take them away from the real world. They think that, that will be the best way for the person who is doing it. But yeah, I understand the data is not available. Yeah, for you to
and
analyze
from
these things.
yes, absolutely. From time to time, there have been various study or research has been done. For example, this UNESCO study that was published in 2019, it also talks that at the primary level, at the middle school level, high school stage, and all, every time people who are associated with alternative gender and sexuality, they have been harassed. They have been harassed sometimes physically, sometimes sexually, sometimes
Yeah.
verbally, and
Yes.
we like I mean 40 3 per percent, if I give example where reported the students were sexual harassment, mm,
Hmm.
where at the primary school students.
School
And
level.
I talk about the reporting mechanism, that it says that only 53% of those who had complained
Mhm.
uh, any file, any report, I mean, the authorities took action. And forget about this study. I mean, if I give example from the real life, I mean, I work very closely with my community. So
Correct.
when I have come to know the issues and challenges they are facing, by getting bullied or fear, physical harassment, and I ask them that why don't you go to your counselor or a mental health expert these days you are having in all almost educational institutes.
Hmm.
So they tell me that, ma'am, even if I go to them, they will ask that why it is happening to you only, why it is not happening to others. That means the problem is within you. This is
Right.
the system. I think that's why I was trying to tell you that identifying the problem is very, very much important, the root cause. and,
Right.
and like there should be a gender and sexuality curriculum in all private and public educational settings. That is absolutely missing. I mean,
Yeah.
that should be done from the very early stage.
Yeah.
That will, promote more acceptance towards all. I mean,
I agree with what you're telling.
students and
When the
all.
child is bullied and when they
Yeah,
go, when you say, why don't you go to your counselor or, anybody in school, when they ask, why you, they are not even aware the answer that they are giving. The answer is more in depth. So I agree with what you're telling. So that is that, we do need to bring more awareness, and that's the reason why we are speaking today. We are trying to do whatever the little bit we can do in by bringing awareness to the community, which is the most sensitive community right now. Yeah, I agree to that. Now coming to
yes,
healthcare.
uh,
Healthcare,
yes,
what kind of a support is there from the government,
yes.
or how is it that you're working towards healthcare for your community?
Yes. Also, before going to healthcare, I will also touch your other question, that how we are contributing to this cause. I mean, for example, if I have talked about that from time to time. Whenever we get opportunity, we take sessions on gender and sexuality for educational institute. I think at this stage, I mean, at this time. People are I mean, if I talk about the young people, they are more accepting, because if I talk about my childhood, at that point of time hardly any LGBT organization I could see in my own city. But now there are so many things are happening. For example, if I talk about transgender person protection of rights act, so government is trying to help those. I cannot say that nothing is happening. Yeah, something is happening definitely, but reaching to educational institute, absolutely. If I sum up how we can do that, absolutely, absolutely the organizations, the community expert, they have to reach out to those educational institutes. They have to interact with the students, with the teachers and all. And these days also, like if I give example of University of Delhi, they have started a transgender resource center. I think
Okay.
this kind of initiative should be scaled up in all the states, where they actually try to help the transgender students. And I think it should be for all gender, sexual minorities people, actually, to help them to access to inclusive education. If they are facing any kind of a problem, how they can help them. So I think this kind of small initiative actually can contribute
Yeah.
very meaningfully to the process. Yeah.
So
Uh,
if I can ask you a question, when you said, you had challenges, when you were growing up, when you said that, so, what kind of a support did you find during that time?
it was very difficult, actually. I mean, I have to talk to myself. I mean, at that point of a time, if I talk about, uh, I'm 73 uh, born. So at that point of time in Kolkata, I mean, I was male assigned at birth, and like during like going to my schools and all. Every day I was thinking that, oh, again I have to go to school, again I have to get teased and all these things. So it was very difficult. So more, and it was very difficult for the parents also to understand and to make them understand that why I'm like this. And also most of the time, I mean, my parents were not very happy because I started to cross dress. I mean, even I was in class 3 and 4. And so it was very difficult for them at that point of time to understand or accept a child like me. That actually happened at a very later stage, actually. But I had to go through these stages of trauma, pain, and one thing was like, trying to convince myself that while I could see the transgender people, the people who are gender identified going through the road, people are teasing them. I was thinking that I am also part of this. I think maybe because they do not have education, maybe they do not, they cannot
Express themselves. Yeah.
express themselves, state their problem and challenges. So I think I should, by hook or by crook, I have to complete my education first. Then only I'll be able to do something. So
Correct.
even having all those problems, challenges, and all that, passion or zeal was in my mind, so that I could complete my basic level of education. And so slowly, actually, I did. After my graduation, I also did my post graduation in social welfare. I'm a trained counselor. So all these things happen. Uh,
Fantastic. That is so. Thank you for sharing that also with us. So, how you educated yourself because you wanted to empower the community. You did see how they were lacking education, and that is the reason why they were struggling with means and things like that. Yeah, thank you, Amrita, for sharing that with us. Yes, to go on with the next thing
yeah.
about mental health. We do know that that is the most important thing. Once
Yes.
you take care of your mental health, everything else can be taken care of. You will be able to take care of yourself,
Yeah.
and that being the reason that we are here in this chat now.
Yeah.
Like you said, you can't say that they are not doing much, but they are doing little. They
Mm.
are bringing awareness to schools and colleges and in primary, secondary, higher school. They are bringing these kind of things. Today, if you say that we are in now, you are making some programs which could be given, like you said, it has to be brought into schools. You said in Delhi they are already brought a research center for this community. I always agree. When we were all growing up, I am much older than you, but I remember we used to have moral science class. That is something that I keep enhancing nowadays, to tell that it is so important to give moral education, where we can bring a lot of things, sensitive things can be brought into a study, into a group, where there is sensitivity and some education is also given. So asking you, so is there, now that you're going to schools and giving any kind of these programs to schools, or is Alliance India with, along with the government, doing any kind of programs like that? Are you people doing anything of that kind right now on a structured manner, I'm asking?
Yes. So structured manners, I think, starts if we have a curriculum. I think that part, I mean, we have to do strong advocacy, and I think that is our collective responsibility, that to
Correct.
at least to bring some kind of a gender or sexuality curriculum. And until and unless, if because that is a state part, I mean, state has to be active on that.
Hmm.
uh, because we know that education is a state subject. So
Right.
this apart from that, I mean, till then, I mean, until and unless we do not have that proper curriculum, I think it's the responsibility of the community expert, the community level organizations, the organizations who are working for people like us, to reach out to education sector, either public or private, to
Right.
reach out to the students, and how effectively everyone can actually have kind of access to education without any discrimination. And that can happen when we have at least some information around ourselves, around the different forms of sexualities, different forms of gender identities, how we can be more accepting to each other. I think those part definitely we have to involve into from time to time, as much as we can. That
Yeah,
is
yeah, like your slide rightly says, the reasons for poor mental health, you have all these things. Yes, that is so important, that these are all the expressions of people who have been abused, and these are the challenges that they face, whether they are voluntary or involuntarily. They are forced into situations, and so if we are giving any kind of an educational program or awareness program, these things can be well avoided, isn't it?
yes, absolutely.
Yeah.
So, I think you have also gone across some kind of experience. I mean, if you have met any LGBTIQ person, sometimes parents also, force for corrective rape. And parents also think that, I mean, if my the child can get married, or I mean, if I can give any kind of a conversion therapy, that will help. But that is absolutely unethical that we do, and that should not happen. And sometimes this unsafe sexual practice, you absolutely know, that can lead us to like dangerous infections like HIV and all. And then if I am continuing facing like physical violence, sexual violence, it
Correct.
absolutely, it is bring bad effect on my um, mental health. And
Right.
this extortion and blackmail is very much happening, I mean, in cyberspace and everywhere. That also, I mean, people like you can have like idea that if someone is a like trans identified person or a like gay identified person, there are opportunities for other people to use that to make
Yes,
uh,
against
money
you.
out
Yeah,
of it.
used it against you. Yes,
Yes.
and use your vulnerable side and blackmail you. Yes, I agree. I agree with what you're telling.
And
Yes.
what happens if I have to continuously face all these things? Definitely, at times comes when people have to get addicted on alcohol, drugs, substance abuse, and all. And
Right.
then ultimately, it leads to isolation, some kind of isolation with the outer world, and it also brings internal phobia. So I think everything is very, very much interconnected. So I think the service sectors has to work very intensely,
Yeah.
involving these people. How more comprehensive service can be provided? That can be education, that can be healthcare, that can be livelihood. So I think that time has come when we should speak more about equity rather than equality.
Right. 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 Right.
Instead of
Correct.
sympathy,
Correct.
you also told that it should be empathy. I mean,
Yes.
I can how I can put myself as a so-called normal person to the other
Right.
person who is facing the problem. That is very, very much important.
Yes. Yeah. The way you react. Yes. Yeah. We have a lot to talk about. But yeah. So yes, please go ahead with the healthcare. Yes, we would like to know
Yeah.
how what is the status of the healthcare.
Yes. So this is like, yes, government is trying to help us. Definitely now this act is there in place, Trans Act. But if I talk about for my own community, especially for the transgender community, I'm not sure which government hospital has a dedicated bed for a transgender person.
Mm-hmm.
And still now, like people have to run between male and female words. It
Yeah.
also is like using of washroom. That is another kind of a
Correct.
challenge. And
Correct.
if I talk about the gender affirming care, like there are various stages that includes hormone replacement therapy, counseling part, surgery, and other primary care. And also definitely we need to have a India specific guideline. Already we have that guideline introduced by uh, WPATH, that is World Professional Association for Transgender Health.
Mm-hmm.
There's an Indian organization who have tried to work on it, like and there's like Asia and Pacific Trans Health Group in also. So
Okay.
research, a guideline, like a study, on like how to make the transgender healthcare or other, like if I talk about lesbian, gay, bisexual, any community who are marginalized is absolutely very much important.
Mm. All right. Okay. Okay. So if I can ask, what kind of a legal aid do you have?
Yeah. So legal, it means now you can see, I mean, you also told that times are changing, but if we still see that how many of us could actually have the power to go to the police station and make them convince, please take my report.
Correct.
Sometimes, most of the time, it happens that the complaint is not being taken, or instead of like bring action against the perpetrator, the
Correct.
victims, they are like discriminated because they are trans or because they are gay. I mean, I can show you the example that in Mumbai, a great majority of the Gujarat identified people, they have stated that experience problems, caused by the police itself, and policemen from respective police station. I mean, how they harass them, including railway police, traffic police, and all. And also, there has been a study that's done by National Institute of Epidemiology, and that was like involving 60,000 transgender people across 17 states, and they have also have different findings. It also says that the abuse begins at the early age when they are like 11 to 15 years of age. 44.7% reported that facing like the 208 sorry 2,811 incident of violence they have faced.
Yeah.
28.4% said that without education, vulnerable, I mean,
Yeah.
they become more vulnerable. Then only like 7%, I mean, they could live with their family, because most of the time, I mean, family is against us. We have to, leave home. We have to join sex work. We have to join hijra culture, because options become very limited. I mean, that's why I was telling you, everything is very much interlinked. I mean, if
Correct.
I'm not getting proper services, proper care from my own family, from my schools, from my neighbors, everything. And ultimately, I have to leave home, and ultimately, I have to make myself vulnerable, and that puts myself in various kinds of a problem, crimes, and violence and all. Yeah.
Okay. Okay. So what about livelihood? What is how can what is happening? What are the developments that are there, and what opportunities are there as a livelihood? Because it's a personal choice, and it is something that there needs to be more acceptance. But we still do find people who are not having a proper livelihood.
Mhm, mhm. See, this is absolutely an important issue for everyone. I mean, you have to live, we have to survive, we have to earn money, and it's very much important how we can make the workplace environment more inclusive for people like us. Most
Right.
of the time, that is because of non-acceptance, because of like lack of like proper policy. I
Yeah.
mean, people have to leave their uh, workplace, and like this is an experience shared by the community only, that most companies, they seem to have hiring transgender people. If I talk about the transgender people, just for the sake to tick the boxes, but
Right.
without having the fully understanding about the community, how they can help us. And
Okay.
nowadays there are certain corporates also, they have diversity and inclusion cell, but the thing is that it's not happening in a like a wide way, because only handful of us can like talk about that. Okay, I am like highly educated, or I am associated with some corporates. They're a very small example. But if we talk about the like large figure of the entire LGBTIQ community members in the India, it's not, it's still we are not there that we can say yes, we are educated enough, we are getting the livelihood support. I mean, if I give a small example, I mean, whoever is crossing the traffic signal, you can see that Kinder people, Hijra people, they are asking for money. Why?
Correct.
Why it is happening? Because there is no livelihood support. And why there is no livelihood support? Either, I mean, they are thrown out of the education system, livelihood system, and all. Because I have seen even people who are graduate, even people who are literate enough, they could not get the proper livelihood support just because they are LGBTIQ people. This should not.
Right. Yeah.
And how we can change this, can be done, that definitely the corporate sector, the workplace, they have to involve community expert, they have to make their policies accordingly, for like giving their support to all their employees. And the CSR unit, the corporate social responsibility units, the DNI cell, diversity and inclusion still, I think they all have to work together, involving the community members. That is very, very much important.
Thank you. You answered my next question also, because my next question was way forward, and you gave me the answer for it. Yes, I totally agree that all we can do is that we need to bring in more awareness, and that is the reason why we are in talk with you today, to understand the challenges that your community is facing, and what is the way forward for this. How we can do it is only by bringing in more awareness, understanding the community, understanding the emotions of the person who is going through it, give care to the person who is going through the changes, and also the caregivers, the families, the community, and bringing more awareness towards these kind of sensitive topics. Yes, like you said, corporates, CSRs, the government have to give support, and where we can eliminate unemployment, where, as you rightly said, that how they are asking for money, and why they are doing it, because they do not have a proper employment policy, that which needs to be brought in a broader spectrum,
Mm.
I suppose.
Yes.
Yeah. So yeah, thank you, Ms. Amrita, for coming, and thank you for sharing your even personal details with us. All we can say is that we are taking the first step forward towards bringing awareness. And here, me from Pran, I thank you so much for coming in and giving us this so much of valuable
Yeah.
information and your time, and sharing such personal information with us too.
Mm.
We hope to, we are in working towards this. We, as me being from Praanwellness, we are taking the first step forward towards doing giving awareness programs.
Yeah.
And yes, we will all strive together. We are all belonging to the same community, whether we are A, B, C, D, LGBTQ, whatever we are one community, and we need to work towards the betterment of one another, and have empathy for one another. That's what we
Just,
are working
yeah.
for.
Just my last suggestion is that, I mean, it is very simple step can make actually a lot of changes. For example, I mean, if I'm a LGBTIQ person, first of all, I have to accept myself. I will I will feel myself free enough that I will tell if the person is not understanding that my name is ABC and I prefer this pronoun.
Right.
On the other hand, as a so-called normal or straight person, if I don't know the person I'm talking to belongs to LGBTIQ category, simply I can ask, may I know your preferred gender role? May I know your preferred pronoun? That will give us more space, and that will give us more acceptance at the both end. I think that is the last message for the today's session that I
Yeah.
give, that as a community person we have to be more accepting to ourselves, that if everything time, because charity begins at home. I am whatever I am, and definitely it's also the part of the like larger society, that
Yeah.
we have to understand that we are also part of the larger
Yeah.
society. We can also contribute to the community, we can also contribute to the society. Only thing is that we have to understand, and we have to we have to be understanding, and we have to be little more accepting to each other. Acceptance is the key word, I think.
True, true.
Yeah.
Although we do find today, when you ask for gender, they do have male, female, other, and if you do not want to specify, they allow you not to specify also. So these kind of things are still coming, but that is not enough. Like how you are trying to tell me is whatever is happening, but it's happening slowly,
Yeah.
and what's happening is not enough. Is the last word that
Yeah.
you would just say, right? That is just not enough. We need to do more.
Yes.
So let us strive towards it, and let us bring in more awareness, and let us hope that we can just be more sensitive towards all the communities that are here, because we are all together for helping one another. Thank you, Ms.
Thank
Amrita,
you.
for coming in and giving us your valuable time. We really value all the words that you have spoken. Thank you so much from the team,
Thank
Pram.
you so
Thank
much.
you.
Thank you. Bye. Take care. Thank you. This is